So hopefully everything is coming in fine and we're live on both. So I'm
Perfect.
mostly going to open this camera. I might alternate from time to time to that camera. Those of you who are watching this front facing camera, whenever you see me looking off to the side, it's because we are also streaming on Instagram. So welcome everybody. We're doing a live Q&A about healthcare entrepreneurship. And we get questions all the time, whether it's via email, phone call, to our social media, asking us questions about how to get started, how to scale, how to enter the healthcare entrepreneurship space. My history is that I come from home healthcare and healthcare staffing, grown businesses within those verticals, continue to do so, and decided to start a consulting firm that helps other people get into the space as well. Because I started to get a lot of inquiries from my press campaigns and talking about it on my main channel, and got enough inquiries that it started to make sense to offer products and services to anybody who's looking to get started. So that's just a little bit of background on me. Turning it over to Veronika. Veronika and I started working together, I don't know, 2 or 3 years ago now. And she functions as the operations manager for our consulting firm. So those of you who are already working with us definitely know Veronika, or if you've been following the channel, you definitely know who she is. But let me turn it over to her.
Hi, I'm Veronica. Thank you for letting me join you in this live. This is my first time going live, so I'm a little nervous. We'll see how it goes. But I hope I can be of help when answering some of you guys' questions.
Awesome. So, so the idea, like I said, is actually came about to really just start giving as rich answers as possible without the consulting fees, and a few things will come out of this, right? You guys will learn something, and we'll get some sound bites that we can use as content, right? So it's kind of a win-win for both of us. Um, Now, there were some questions that came in. Brenda, if you can, could you start to just go into, I don't know if you're allowed on your device, but look at some of the questions that came in from my stories related to how, like, what sort of questions people had. Now, I remember one of the questions offhand was how much money is needed to start a healthcare staffing agency? And this is a question that is probably one of the most frequently asked. The startup cost could be relatively low. It all depends on how you want to start one of these companies. If you decide that you want to start as lean as possible, I think the most conservative number I could give is that your starting capital is going to be about $5,000. And that's going to cover all your mandatory insurance, setting up your entity, and maybe some of your kind of public facing marketing. So we're talking your website, maybe your business cards, brochures, that sort of thing. So to create your company, get your deposits in for your insurance policies, because your insurance policies are going to vary based on your company size and what sort of level of coverage you get. But just to get the deposits going, to get the bare minimums done, is going to cost you around $5,000. Now, obviously, there is never a limit to how much you're going to spend on the upside, but we find that most of our clients are spending around $20,000 to get started, whether they're working with us as consultants or kind of doing things independently. They're going to be around that price, because if they're doing things the right way, they're going to have to seek out attorneys. They're going to seek out the advice of consultants. They're going to spend money on nonsensical things. What we do here is we try to streamline that process so it's as efficient as possible while hitting all those points like legal, accounting, product design, service design, website design, your policy and procedures, etc. So that gives you the range of what's realistic. Now, another question that kind of comes right after that is, well, how am I going to cover payroll? Right? So would you agree, Veronica, that payroll is kind of a common question?
Yeah, a lot of people think that they need $100,000 to get started because they're not aware that there are options that they can use to float their payroll before they get paid, right? Without having to use their own money. So that is definitely one of the questions that a lot of the people that I talk to on a daily basis ask.
Okay. And how how would you measure the necessary payroll flow?
So what I usually tell our clients is that it's going to depend on how many people they're starting with, right? Their first contract might be with one placement, and if that person, for example, is a CNA, chances are they're not going to need a whole lot of money, right? Because they're only going to be paying $20 an hour to this person. Say they're working full time, they could manage with a couple $1,000s a month. But if their first contract is with a facility that's giving them 1,000 hours a month right off the bat, then they're obviously going to need to have more payroll. So our advice is always try to get set up with a factoring company, so you will have the necessary funds once you get started, and you're not being limited to what you have at that time, or having to say no to placement opportunities because you don't have the money.
You want to simplify that, not simplify it, but do you want to kind of go a little bit further into the factor companies, because that might go over some people's heads
Yeah.
who aren't in the space just
Yeah,
yet.
get that. So, yeah, for factoring companies, the factoring company that we recommend specializes or works mostly with healthcare staffing agencies, right? The way they work is the first step in the process is you need to be approved by them. So they run a criminal background check. They make sure that you're clean, and if you pass that first test, the next thing is going to be whenever you get a contract, you want to send that contract to them. They will not base whether they give you a loan or not on your credit or even your company's credit, but they will do it on that facility's record and that facility's credit. So whether they give you a loan or not is going to depend on the contracts that you have and where the facility is standing, right? They have their ways of proving, making sure that they're actually paying the providers that they have, and based on that, they can either say no, we won't give you the money, yes, we will give you whatever you need, or they can tell you a maximum amount that they're willing to give you up front, right? It's can be 20,000, 30,000, depends. So that is what the process looks like with them. Obviously, there's a fee. Their fee starts at 1% every 10 days. Most of the contracts that I see our clients get are between 30 to 45 days before they get their first payment. So you will be looking at 3 to 5% of the billables that you will end up going towards the interest or the factoring fee.
Okay. And what if they kind of don't want to go that route? What do you think would be some other options?
I think if you don't want to go that route, uh, and so some of our clients, they have come to us and they have said, I don't want to go that route because I don't want to have to pay that fee. For me, the way I look at it is, yes, you're going to be making a little less money because they're going to take an interest fee, but you're going to be limiting yourself. But if you have the funds to do so and you're willing to put your money um, up there and risk it, then that's fine. If you don't have any money, then you don't have any money unless you can get some sort of traditional loan from a bank.
Yeah, I think, when we started out, we didn't have any of this information. And we started out with friends and family as our first employees, and we let them know that we were going to be on some form of delay on making payment,
Yeah.
which obviously is not going to fly with a stranger.
No.
But with if you like, a lot of the people who come to us are usually healthcare professionals to begin with, or they're the partner of a healthcare professional, and they're thinking, hey, I could put together this company for my wife or with my husband, and we could start staffing. I'm already working for other agencies, and those sort of smaller organizations are going to start with friends and family as usually their first placements. So
Yeah.
those people are a little more forgiving. And you say, hey, like, I'm on a net 30-day contract. Just pick up some shifts and I'll be able to pay you in 30 days. Now that works obviously if someone else, the people that you're placing already have full-time work and this is just extra
Yeah.
cash. But that's one thing that could happen. We started with 5 grand, and those people who weren't in a position were the ones that we kind of covered payroll for and managed that money until we started to get reimbursed, and kind of built on that, drew down from 401ks, tapped into savings. All of these things were the things that we did because we didn't have business credit, we didn't have a factory relationship, we didn't have a line of credit, none of that. We just started kind of raw. But I believe that those factor relationships are going to be your quickest, easiest way to getting the cash that you need to meet your obligations. And it's not too expensive because they're usually going to give you a haircut of like between 2 and 3% on your money. And what I mean by that is if you had $100,000 of payroll, they're going to advance you a portion every time you create a bill. But
Yeah.
when the final bill is paid, they're going to hold back that 3%. So on 100 grand, they'll probably hold back $3,000 as their cut. And that might be 3% per month. Oh, that's a lot of money, but it's better
Yeah.
than not being able to do $100,000 in payroll where you're earning 20 to 30% spread. So you have to
Yeah.
kind of think of it that way.
And it's also good if going into it, you already know what their fee is going to look like, because you can take that into account when building your rates, which is actually a question that we get asked a lot too. How do I build my rates? How do I know how much I should charge for my services? So yeah, if you know right off the bat, okay, this factoring company is going to charge me this much, these people from this facility are going to pay me every 30 days, you know that you need to factor that in. Make sure that you're making enough profit to actually justify that placement.
Right. So that covers that topic. So I guess just to give one final clear answer, if you're going to be starting one of these healthcare staffing companies, budget around $20,000 as your startup cost, just to be conservative. And where you save. And you're going to want to make sure that you either establish a relationship with a factor who's going to advance you on your receivables, or you get some sort of traditional line of credit or savings that will allow you to float whatever you think is your future payroll. So if you're saying, hey, you know what, I could float maybe 30,000 a month. If you think you can float 30,000 a month, you probably, because that's the amount of money that you have, you probably want to budget for 2 months because there's going to be delays in payment, delays in process. Sometimes they mail checks. That takes as long as it takes. So I like to recommend that people have 2 months of their payroll float available in cash or line of credit or factor relationship, just so they never find themselves in a situation where they have to let their staff know that they can't make payroll. I've been there, not a comfortable thing. So having the 2 months of cushion is a good idea.
Awesome. Let me check what questions we have here on Instagram.
Awesome.
So Brenda asks, what is the best strategy to leverage a contract with a facility? What are your thoughts on that, Karl?
What is the best? One more time. What's the question? Or actually, can we put that question into the? Actually, I'll put that into the chat that's going on over here. So okay. Brenda, if you can add, Brenda is our social media manager. So she's going through the questions that came in from the stories. But Brenda, if you could add those to the YouTube stream, that would be great. But I'll type this question up. So what
is the best strategy to leverage a contract with a facility?
To leverage a contract? I guess to get a contract. Okay. To leverage a contract
with a facility. This is one of our the questions that we get asked the very most too. People are always coming concerned about the money and the contracts, right?
It's the money and the money.
Yeah, the money and the money and how you get the money.
Exactly. So the contracts, to be quite honest, not that I'm like in the habit of being dishonest, but to be as forward as possible, your contracts are going to materialize best from well-established relationships that you already had. So that's why I always feel that nurses are in the best position to kind of thrive in this business, because they can work themselves. They've built friends over their career. They have an in already, usually, to allow them to start kind of getting that first contract. But essentially what we're doing in this business is we're satisfying a need that the facilities have, right? Hospitals and nursing facilities, they need staff to treat their patients. They need a facility. They need beds. They need equipment. They need meds, right? These are all the things that they need in order to conduct their business. So we're providing them with an essential need that they have to meet their objectives. So if you have a relationship with a facility, it gives you the opportunity to be heard and get an answer. If you do not have a relationship with a facility or with a manager or decision maker that is able to sign off on a contract, you're essentially coming in cold. And the first thing that needs to happen is that trust needs to be established, right? They need staff They may be working with agencies, they may not be. If they are the decision maker and they need staff, they still have to trust you in order to conduct business with you. So if you have a pre-existing relationship, the trust is already built in there. They know you as an employee, if you're a good employee. They've known you as a contract worker coming from another agency, and they love you. They want to renew your contract. Those are opportunities to discuss how can you work with that facility directly, right? If your best friend is the director at some skilled nursing facility, and you tell them, hey, I'm starting on an agency. Do you work with agencies? Yes. What is it going to take for me to get into the building? Your friend is going to be honest with you and say, hey, we're willing to take on new agencies, or the price needs to be this, or we really need CNAs. If you could bring me CNAs, I could work with you. It eliminates having to introduce yourself, prove that you're credible, build that relationship, get the trust. So relationships are going to be your best, the thing that you could leverage the most to get a contract. After that, it's all about being visible to the potential vendor. If they don't know that you exist, then you don't exist, right? It's like if the tree falls in the forest, doesn't make a sound. Obviously it does, but if they don't see that you are out there, then you don't become an option, right? So it's about being heard and seen. So that's going to be those cold inquiries. That's coming in cold via phone, email, LinkedIn, because at that point, that's your first moment to say, I exist and hear me out. Then the relationship gets built. Then you start to discuss rates, what you could do, what sort of problems are they having that you could solve through your agency. What are their objectives? Can you help them with their objectives? You have to remember too that in most cases, agency staff, they're more expensive than internal staff. And these facilities' budgets are designed to kind of around internal staff, right? So when it comes to rate negotiations and actually getting in, it's like, hey, I don't want to spend more than I have to spend for the resource. So the closer you are to their true cost to employ, or if you're able to save them money because they're spending way too much in overtime, maybe your contracted rate is less than their overtime, right? It has to make sense for them financially. So if you're coming in cold, it's understanding what are their objectives and really being able to help them solve their problems or meet their objectives. They really could care less about making you money. That's not their business, right? Their job isn't even to go out there and find new agencies. Most of the decision makers, their job is to run the facility, to run the unit, etc. So their job isn't, I am in the business of enrolling agencies to fill my staffing shortages. Even in the human resource department, sometimes it's a human resource manager that initiates the contracting process. When that happens, they're kind of surrendering and saying, hey, we can't figure it out internally, right? Even though that's my job. So now we're going to go to a third party and they're going to charge us more, and I'm not doing that's really something that a recruiter or a human resource manager is not going to want to admit. And it's kind of counter to their job in a way. So you have to keep all these things in mind when you're going into contract negotiations. But as long as you stick to trying to help the facilities meet their objectives, you at least have a conversation, and then it's building trust, everything else making sense, and then actually providing service. Once you start providing service, is the service good or bad, right? So those are all the steps. But if you're going to leverage anything, it's going to be relationships.
Awesome. So what advice would you give to people who are making these phone calls for the very first time and they're perhaps not a healthcare professional who has any experience or has worked within the field before?
Honesty. If you're calling into a facility cold, you're completely an outsider to healthcare. It's gonna always feel like a money grab. right? To the
Yeah.
people who've dedicated their life to patient care. So if you come in cold, you have to first get past the receptionist. Because if you start I see it all the time with our clients, they're so excited to mention their company name, who they are, what they're doing to anybody who will listen. So they get the receptionist is like, "Hi, I'm Karl Pierre. I own AidBook or Avalanche Care or Elite Medical Staffing, whatever. And I'm looking to help you with your staffing shortages." Receptionist is gonna
Yep.
kill that call.
Not interested.
Yeah, not interested. My job is to
They might not even
eliminate.
know if they're in need of staff in a lot of
Yeah.
cases.
So it's like that usually doesn't go so well. So I think the best way would be to come and say, let's try to reach a decision maker. So in most facilities, like I said, it's going to be someone who's managing human resources or personnel, someone who is on a director level. So either director of nursing, chief nursing operator, or chief nursing officer, um, hospital administrator, assistant directors, people who are in those roles that kind of oversee the overall operations. And if they're not the decision maker, they should usually know who is. So you try to seek out those folks and you let them know, I am new to the area, I'm new to the business. We know that a lot of facilities. Can you just talk to me about how you're dealing with your staffing issues? Are you working with the Ask questions? Get them talking to you. Are you working with agencies now? Are you satisfied, dissatisfied? Are there any positions that you're still struggling with? Are there any changes to your staffing needs that someone like me may be able to help with? If so, what are those changes? What you need to understand their needs and align yourself with that.
Yeah.
So that's where I would say to start. You can't just come in sounding salesy. It's better to come in a little more humble and as if you're trying to gather information, because that's going to even prepare you to respond, or that's going to prepare you to go back to the drawing board and say, well, this place said that they really need landscaping staff. They're for whatever reason. And I never thought about staffing landscapers. Like, okay, let me look into that and see if I'm able to find a group of landscapers and place them there. I'm
Yeah.
just giving like an outrageous example, but it's possible. But you may learn something from that conversation that helps point you in a new direction or in the right direction. So when you have the next call, you're a little more competent, you're a little more aware.
Yeah. And another thing is, I think people should also come prepared with questions that they know they think they may ask, right? Like some of our clients that I've spoken to in recent times, they've told me, "Hey, I before I went with you and I started to build my agency, I actually started making phone calls to see what the need was, and they were in need of staff. And when they started asking about my terms, my rates, what type of staff I had no idea what to say." So I think that is something that you can avoid by, doing a little bit of research and at least having a range that you can work with for when they ask these questions. They're gonna usually ask, how much are you paying, or can you send us a service agreement? Those are the things that you might want to have in place once you start making those phone calls, because yes, in a lot of cases the receptionist might hang up, or you might not be able to reach the decision maker in the first call. But what if you do? you know you want to be in a position where you have a lot of the basics in place, so um, they will see you as a professional and someone who knows what they're doing, although it's your first time.
Yeah, we got a good question coming in from YouTube. Is it possible to see sample hospital contract or to talk about rates specifically for acute care centers? You could actually Google um, medical staffing contracts. You could see about quite a few different variations of them. Every contract, this boilerplate contracts, some facilities have their contracts. Sometimes it's the third parties that you're agreeing to their contracts. Sometimes the third party has a master contract and then addendums for each facility that's in their network. So you could find contracts. That's not going to be an issue. Just Google, find them, read through them, and you'll see that they're generally the same. They lay out who's the employer, who's the employee, what's the relationship, any conflict of interest, service terms, uh, rate reimbursement terms. They're never going to really disclose rates, but you're going to see what is it, a net 30-day contract, net 60, net 90 in some horrible cases. And you're going to see exactly what they're looking for. They may specify kind of the holidays that are going to be honored. There's going to be all kinds of language you see, and you'll start to see that there's a general theme that they all follow. Okay. But when it comes to rate, my rule of thumb is that your billing rate should be 1.5 times your anticipated pay rate for that position. So I'll give you a very basic example. If you're expecting to pay CNAs $20 an hour, then your bill rate should be $30 an hour or more. The reason for that is that your cost to employ, workers' comp, payroll liabilities, maybe your cost for your money is going to be between 20 on the low end, maybe 17%, on the higher end, about 25%, again, depending on your state, your workers' compensation rate, the cost of your money, et cetera. So by charging a markup of 1.5, you're now in a position to pay all the mandatories and still walk away with a spread, okay? At the same time, that 1.5 rate is also going to be in line with their overtime rate or their fully loaded cost to employ that same position. Once you start getting above that, it becomes more and more stressful for them, because think about it. If you're a business owner and your budget for a worker is $27 an hour, right? All in for a CNA with their benefits, their pay time off, everything is $27 an hour. Their base rates are maybe $19 an hour, right? So time and a half would be roughly $27. And their all-in cost would be $27 if it was regular pay. So they're not going to really want to be above that $27 an hour mark. If you're at $40 an hour and they had to agree because they were so desperate, the line item that they're going to be trying to get back to 27 is going to be that. And they're going to be very focused on moving away from that $40 an hour rate to get as close back to their true budgeted cost. So by being in at 1.5 times, you're usually in the ballpark and you're going to be profitable in that scenario. Can you get double? Sure. Can you squeak out a profit at 1.3? Yeah. 1.5 to me is the sweet spot for starting a conversation and not being in a where you negotiate your price too low or you're presenting something that's totally outrageous. Now, how are you going to get to what your pay rate is supposed to be? You have to do market research, right? So if you're in Niagara, New York, you have to look at what's the pay range in the acute setting that you're planning on staffing in. And what for the positions, look at what their base rates are from the being paid directly from the facility. Let's just say the facilities are paying $18 an hour for the same CNA. What are the agencies paying directly? What is the float pool paying as per diems direct from the hospital? With those three, you'll get a good range of the lower end to the higher end. Usually the float pool, per diem pool, agency pool pays the most because they're not including benefits or anything like that, right? So they load on the rate. When you're directly employed and you have benefits, it's usually a lower pay rate because they're allocating some of that budget to your paid time off, your medical benefits, retirement, etc. So that will give you the realistic range of what people are accepting as salary. Okay. And from there, you could average it out. You could get a blended rate. You could do whatever you want, but it'll give you kind of where you're starting at. So if you find that the average, let's just say it's 18 direct, 20 from agencies, 22 from the float pool. All right, that averages out to $20 an hour. You apply the 1.5 markup to that number. Again, in our program and the people that we work with, we have spreadsheets and tools to help you with your negotiations and testing of rates to make sure that you haven't negotiated the wrong rate. So if you're ever interested in that, just kind of reach out. We could kind of educate you on that and get that rate spreadsheet to you. But that's how you would go about it. I hope that answers it.
I have some questions Brenda sent from the Instagram stories
Sure.
yesterday. One of them says, is LinkedIn a good resource to get contracts with facilities, or is cold calling slash emails better?
Um, it all depends on where that person's attention is. Their
Yeah.
email, call, and LinkedIn are all very cold starts. They don't know you from a hole in the wall. You're a voice on the phone. You're some dude, sending a message on LinkedIn, or some woman sending a message on LinkedIn, or you're, just another email. They don't know who you are. So I would say they're all kind of. LinkedIn is helpful in that they at least get to see if your face. So if you're attractive, that might be helpful, right? Somebody
Yeah.
might say, "Oh, who is this?" Right, and actually give
Yeah.
you attention to even be heard. If they're not active on LinkedIn, you could be sending millions of messages and they just never check their LinkedIn. They're only on LinkedIn whenever they're looking for a new job. That's not their
Yeah.
social space. So all like people are going to be receptive in the form of communication that they like when coming in cold. So if there's people who never miss an email, they check and read every email, uh, that they might be the best ones to reach by email, but you won't know. So if you're going in cold, you should try all three.
Yeah.
If the person is active on LinkedIn, right? Simple strategy. If they're active on LinkedIn, they're posting articles, they have a community going, start chatting with them. Go ahead, get in their comment section. Start chatting with them and say, wow, great
Yeah.
article, etc. Would love to talk, whatever. And they'll eventually see you and say, you always read my stuff. Right? It like if you're creating content, especially to a quiet audience, someone just commenting is like validation of some kind, right? But now they know you. Now you're the person that's been chatting them up on LinkedIn
Yeah.
in the comment section, giving them feedback, giving them suggestions, and there might be a conversation. Because what have you done there? You've gone from cold to somewhat familiar, right? And as we said earlier, it's all about establishing the relationship, establishing trust. So
Mhm.
whatever is going to allow you to do that. If you have the gift of gab and your sales experience from a cold calling job, then maybe you have developed really good skills to get on the phone and be charming on the phone. You have to use what works for you and also what works for that client. Because some people never, like I'm someone, I don't check voicemails. I hate voicemails. I don't check them. Right? You get me if I pick up the phone or you shoot me a text message. If it's in my voicemail box, good luck. So what happens there, right? If you're leaving me a bunch of voicemail messages, I'm not even checking them.
Yeah.
So that may be happening to you, but I might be diligent on my LinkedIn, or I might be diligent on my WhatsApp, or so get me where my attention is.
Yeah. And you won't know where their attention is unless you try to reach out however way you can. I feel like if you've already talked to that person on the phone, that person's the decision maker, you find them on LinkedIn, send a request. That might be worth it, because next time they are thinking about getting a contract with a new agency, or they're in need of staff, they might reach out to you via LinkedIn because it's easier for you. Maybe they didn't save the number, but they have you there. So I think it's a matter of being visible and also being reachable.
Absolutely. So, Fountains of Worship International. I'm licensed but don't know how to write the contract. Any advice? Like I said, you could work with a company like ours. We include contracts in some of our packages. We don't just sell documents. You could work with an attorney to draft a employment contract that's going to be costly. And at the end of the day, the facility may have their own contract that you need to agree to. So you could spend money on a contract that you don't even get to use,
Yeah.
right? So a lot of people think like the contract document is the end all be all. It's not. I think it's more important to have a rate sheet than it is going to be to have the contract, because the conversation is going to be more about rate and what you can offer, who do you have available, what is their availability, then it's going to be the details of the contract. That's going to be sorted out once you get past the point of we're going to do business together. Okay, so if you're just licensed and just starting out, make some phone calls, start getting to know people, start doing your market research on what are the salary expectations of the workforce. And once you have a good sense of that, you'll be able to design your rate sheet, because that's where the beginning of the conversation is always going to be around. Okay, I'm interested in this sort of staff. What are we talking about as far as price? How soon can you get workers in here? Do you have a list of workers that I could kind of browse through to make sure that you're legit? So that's going to be first. And then again, with the contracts, you might reach out to facilities, have all these conversations, and then they pass you all over to whoever the decision maker is or whoever is in their legal team. And then they're going to give you their contract, which already has the predefined terms that they're comfortable with. And then you're going to have to review that or have it reviewed by an attorney and agree or negotiate around that. So it goes both ways. I saw this question. So, and thank you, Kareen. So Brenda says, can you build a staffing agency virtually that generates $15K a month from Medellin in 2 years? I could say you can, but it's going to be entirely up to you. How well do you know the industry? Are you well connected? How fast are you going to get up and running? When are you going to get your first contract? Are you talking about 15K in revenue a month? Or are you talking about 15K net? I think it is doable. You know, we have clients that clear $1 million in rev their first year. So that's not like a far-fetched sort of thing. You know, especially on nursing salaries, that can happen quite quickly. So if you were in that scenario and you were averaging a net spread of 20%, then yeah, you would be above 15K a month. Now, is that going to necessarily be realistic for you without knowing you, or without, how could I put this, without knowing how fast you're going to get to market and get your first placement and how quickly you're going to scale? I don't know if it's realistic for you, but it is totally doable. I wouldn't say that that's absolutely crazy. The only thing that I think you're at a slight disadvantage being 100% at a distance, because if they want to meet with you Friday and it's Tuesday, you're going to have to scramble, get on a flight, go there, meet with somebody to maybe land that first contract. Like, there's going to be people who need that face-to-face engagement to close, and there's going to be people you could close 100% via email. So I would say that's probably going to be the only issue. And yeah, I think it's doable. The benefit to potentially starting your business internationally, like in a market like Medellin, is that your supporting team, the administrative workers, like staffing coordinators, recruiters, you could get a bilingual workforce. Like, we help out with that as well. But that's going to help keep your startup costs a little bit lower. If you were starting in the United States and you want to hire a human resource recruiter full-time and a staffing person full-time, even if you're looking at minimums, you're looking at $2,000, maybe $40,000 salaries, and you're just getting started. So that's like a $8,000 to $10,000 a month burn on resources that you may not convert. In another market, that might only be $2,000 to $3,000 a month burn, and you're now a team of 3 for less than one U.S. resource. So that would be one of the advantages that you'd have in your corner. You get that multiplier effect. So if you, again, I'm always going to sell, but if you need help finding resources internationally, we can help with that. Really solid resources. So just reach out. You can go to passiveworkforce.com. There's a link for outsourced staff. And from there, that starts the conversation and the inquiry on what sort of staff we could get you.
We have a comment here from Mrs. Ben. It says, "Hello, I am in Florida. Can I email you in the need of a mentor for my starting home care agency?"
Well, you could always book a consultation. That's on Instagram, so that's here.
Yes, that's on Instagram.
Okay, so if you're interested in getting guidance or help, you could. I would the first thing I would say is um, book a consultation call. They're
Yeah.
hour-long one-on-one calls like this. They're relatively inexpensive compared to what I generate, um, but it gives you that one-on-one opportunity to talk through your idea. I'm not like a formal mentor. That's not my career. Um, so I'm not going to sit there and kind of mentor you. There's other consultants that we work with that can do that for you. Um, but uh, I'm certainly not in the business of mentoring for free. And I'm not going to be the best mentor because I'm not going to pour in 20 hours of time or anything like that into your business. I'm going to spend that time on mine. So, but that's where I would say to start. Also, you can join our groups. You could follow us on social. You could participate in lives like this, ask questions, because that's going to be your opportunity to get some free advice.
Mm-hmm.
And believe it or not, a lot of people who are in your shoes are asking the same exact questions. So if you watch this content, you typically get your most basic questions answered. And if you need, privacy or you need focus, then you have those direct consulting options.
Awesome. Do we have more questions on YouTube?
Yeah. I'm gonna flash it on the screen here. So here's one. I hear staffing firms are notorious for price gouging. What are your thoughts on this? Um, I don't think I don't think staffing agencies are notorious for price gouging. I think they are kind of just dealing in the realm of supply and demand. They also, like, as a staffing agency, as a business, you need to be able to charge a price that is reasonable for you and reasonable for your client. You can't you can't suck the blood of your host, right, to the point of death. So, it doesn't make sense. That's not like a winning strategy. It may seem like the prices are excessive to someone who does not know the financials of the industry. So oftentimes you'll see like nursing directors. This has happened to me, in the days where I used to negotiate contracts, where the bill rate for an RN supervisor was higher than the hourly rate that the director earned at the facility, or comparable. And they would look at the number and just be like, oh, that's just too high, without realizing, because they typically don't know, without really knowing what is the true cost of employment for themselves, right? Even let's just say
Yeah.
they're earning $75 an hour and my bill rate 75. They don't know that their true cost is probably closer to $100 an hour. And they, even just their ego will get in the way and say, like, I can't sign this. I can't sign off on someone getting paid as much as me when they're 2 or 3 levels below me. They just don't know the numbers. So when people say things like that, I go, okay, it doesn't make sense, because you just don't know the math of the business.
Yeah. It
Um,
goes beyond just what they're getting paid an hour. There's taxes, there's workers' comp, insurance, benefits.
yeah, being competitive, right? Because if you look at this COVID era, you had this huge increase in demand for the same resource, and that changed the dynamics of pricing, right? And now that that's not the same, the prices are kind of
Yeah.
readjusting. So if I'm the agency and all of my nurses are saying they will not work for less than X, in order for me to turn a profit, even if it's on the smaller side, like if I'm charging a 30% markup, I still need to mark it up. So it's not like the agencies, capturing every last penny. That's not the case. And if they are, then they're going to probably be less competitive than other payers, and they're going to be the first ones to get cut when they start doing budget cuts. That's just what's going to happen. Awesome. Glad that you thought it was helpful. How can you get the rate sheet document, Veronica?
Oh, so for the rate spreadsheet document, you have a few options. So we offer that for our turnkey members. So if you're looking to start a staffing agency, you have not done anything, you're looking for full support, that comes in our full setup package. You can also enroll in the premium course where you can also access that document along with the lessons and access to the group mentoring calls every month. So yeah, those are the two options that you have if you want to go all in, full setup. You can get that spreadsheet, or you can enroll in our premium course. We do not sell the rate spreadsheet separately.
Yep. It's just it's not something we haven't gotten to that point where we're selling documents, standalone documents or standalone services. We
Yeah,
kind of have
the
a clear
document
sense.
on itself is not going to do much either. You need to learn to interpret what's there and how you can use that tool, which has happened in the past. So we do not sell those.
Tomer. Would you recommend specific states for getting acute care contracts? And are there certain size of hospitals that we should aim for? Yeah, that's personal opinion. I would recommend the higher paying states, New York, California, um, just because you're in the business of making a spread uh, above rates or a percentage of the rate that you're charging. So the higher paying states you're going to make more money. And then they're also high density states. So there's rural sections that have small hospitals, and there's major medical centers that have thousands of beds across the city. So I would look at those two markets, just because they're big. Um, and then like size, it's kind of a gift and curse. Smaller facilities are usually easy, especially smaller standalone facilities are easier to navigate and communicate with than larger conglomerates. That's just how it is. So the larger systems may have way more placement opportunities, but slower to respond, slower to engage with. Uh, everybody everybody that you try to talk to doesn't know who's a decision maker, or they're working with a third party.
Yeah.
So
Or they don't work with new agencies, which happens a lot with big facilities.
yeah, because why don't they work with newer agencies?
So, from what I've seen, a lot of them want you to have at least 2 years of experience, just to prove that you know what you're doing and that you actually have stuff. And some of them will also tell you that you need to have made X amount in revenue to be able to work with you. Because I guess to them, that proves that you're knowledgeable and that you're experienced in the field. So, usually, landing contracts with smaller facilities is going to be easier. And you can use that experience, that data, to then go for the bigger contracts in hospitals.
Okay, cool. So we have Arthur Rogers. Let's see. If you have no experience in healthcare or have no partners, wouldn't this be hard? Yep. Short answer. It's if you're doing this alone with no experience, um, yeah, I think it's like if you try to build a house by yourself and you've never built a house before, it's going to be quite rough. Even building an IKEA desk for the first time
Yeah,
with no experience and you've never built anything is going to be tough. So you'll never see me say that this is an easy business. It's kind of easy to understand, like the logic behind the business. You have companies that have staffing shortages, um, and you're essentially the marketing machine that's able to consolidate these resources that they need and help matchmake.
yeah,
Conceptually, it's easy. to handle all of the moving parts without knowledge, without anything, is going to be a work in progress, and it's doable. Um, when we got started, my mother had the knowledge of being a a nursing supervisor in facilities and working the bedside. So she at least knew the mechanics, the terminology, how things kind of work. She had relationships to leverage. So that allowed us into our first bit. That was our first business. So without that knowledge, you wouldn't even think about doing this, right? It's like you wouldn't think about
Yeah.
mining cobalt for uh, I don't know, uh, radiographic equipment. You wouldn't think about it if you didn't know that even was a thing, right?
Yeah.
So it's kind of like that.
Yeah. Either get a partner who's worked in healthcare or get a consultant to help you navigate through all of the questions that you will have.
You are very welcome. Arthur has another question. How much money would you need to start, including your first payroll, without using any credit cards? Um, we answered this question earlier in the thread, but I'll kind of give a short answer here again. So you're going to need about $20,000 to start this business, and your first payroll is going to be. It all depends on how many hours have you staffed, what positions, etc. So what we recommend is that you have some form of line of credit, some sort of lender relationship to help you cover payroll, or at least enough cash to cover 60 days of payroll for that estimated weekly payroll that you plan on having. Because a lot of the contracts are going to be net 30 and net 60 days as far as reimbursement is concerned. So at minimum, you're going to have to float 30 days plus the time for them to review and pay the invoice. So let's call it realistically 45 days at minimum. So you need at least that amount of capital to float payroll. So that's why I say 60 days, because if there's delays, if there's holidays on the day that they
Mhm.
ship, or whatever the case may be, or the day that they process. That's another one. Like, so imagine a facility that only does bill pay on Monday, and we have quite a few Monday holidays, and this happens. This is a real example. So if bill pay is done on Monday and it's Memorial Day, and I'm expecting $200,000 of payment from this facility for a week of service, but they don't process on Mondays, so it gets pushed off to the next Monday. If you're week to week on a contract like that, and you don't have a line of credit, or you don't have savings, you're going to be in pain, and it happens. So, and then there's others that pay out on Fridays. If it's a Friday holiday, you're screwed. Or if it's Thanksgiving and no one's on work on Friday that does that job, it doesn't get done, right? So um, I would say 60 days of payroll flow and about 15 to 20K to get started. Katina, what do you suggest for nurses transitioning to business? Tools, research, personal development, etc. I'm going to give this one to Veronica.
Oh, well, what do you suggest for nurses transitioning to business, tools, research, personal development, etc.? So you're looking to start a staffing agency. That's what I'm going to assume. One of the things that I notice is that a lot of the nurses that come in, at least our clients, they don't really have any tech skills, right? So navigating through a Word document, navigating through Zoom calls tends to be a little tricky for some that have never been exposed to that before. So getting familiar with the tools that are being used in business nowadays, I think, is a good place to start. You're going to be using things like DocuSign to send contracts. You're going to be using Google Drive, email tools, all of those things you really want to get very familiar with, especially if you're planning to start this type of business online, because that's another question that we get. Can I start this without having a physical office space? Yes, you can, but you will need to be able to set up everything so everything can be done online using these tools that I mentioned. So yeah, I think that that would be the first thing. And then in terms of research, we have a lot of free content on our YouTube channel talking about starting a healthcare staffing agency and all of the things that you should consider or that you need to know going into it and once you're already in it. On your end, you know, there are things that you, as a nurse, you're going to need to know, and you're going to find it easier to know than someone who's not in nursing. For example, as we mentioned before, to calculate your rates, you need to do market research, and you need to find out how much the type of staff that you want to hire are getting paid in the area where you want to be. So since you're a nurse yourself, chances are you can apply to jobs, you can talk to colleagues, compare the rates in the different facilities where you've worked in recent times, and come up with that information. So those are all things that you can start working on before you even go into business, or before you start setting up everything else. What are your thoughts about that, Carl?
Well, I think um, for a nurse transitioning into the business, I would recommend two things. The first thing is partner up with somebody who, especially if it's any of these businesses, well, home care or healthcare staffing, partner with somebody with strong administrative skills. What I find, just like Veronica said, is that nurses and healthcare professionals don't really get solid training on kind of the software tools that are just in the marketplace today. They get trained on how to use the software that, Epic training, et cetera. They get trained how to use software inside the facilities and how to treat patients. They don't learn anything administrative. So they don't have the skills when they start kind of moving into the business world. So I would say get a partner who understands the administrative side of healthcare, because that's going to at least supplement you where you're weak. Where I see nurses really excel is obviously talking nurse to nurse, facility, talking to the
Hmm.
facilities directly with the recruits, letting them know, screening the recruits, making sure that they're quality. So I would tell them to focus on the skill sets that they already have, get a partner. Another thing I would tell them to do is talk to everybody that you possibly can about what you're doing. I Since a lot of nurses tend to, like I said, have worked their entire career in healthcare, they don't really have good sales skills. They have almost no sales skills, and they get uncomfortable with the salesman part of the job. So if you start talking to people that you know about what you're doing, they're going to have questions, and that's going to start conditioning you for the conversation that you're going to have when you go in cold with strangers. So you're going to be a little more confident. You're going to have rehearsed your business description, what makes you different, how does it all work. You'll be a little rehearsed there. And then in those same conversations, you're going to have people who buy into you from the moment that you're thinking about this. Like, hey, if you do this, I'll work with you. If you do this, I'll work for you.
Yep.
If you do this, contact me. We'll be happy to give you a contract because you're awesome. So it's better to, like a lot of people say, stay quiet until you know. I believe the opposite. I believe you talk about everything that you're doing the moment it comes to mind, because you don't know who you're talking to and if they're able to help you or advise you, right? So those are the two things that I would recommend. And we have time for one more question, and I'm going to see which one of these questions make the most sense. Tora has a lot of questions. They're good, but I want to kind of share the airtime for others.
Just remember, if any of you wants one-on-one time to get their questions answered, you can always go to our website, passiveworkforce.com, and book a call with Carl there. Or if you're trying to learn more about our services and what we can offer you, you can schedule a 15-minute call if you go to our website as well. That call will be with me, and we can go over all of the details about our different services, and I can help you navigate through that and what might be the best fit for you.
Okay. We have the anonymous Facebook user. Do we have international workers for home care or staffing? I have international workers for everything that I do, um, from web developers to architects to healthcare staffing to home care. Um, I work with a global workforce at all times. I try to find the talent that's affordable. I try to find talent that's good. I try to find talent that's local to me. So it's a mixed bag. I think I'll take one more question after this because this is just kind of like uh, a little more about me than it is about information. But I think the most important thing um, that you have to consider when working with any sort of remote worker is that you need to make time to train them and educate them on what it is that you're doing. And this is something that I've learned, unfortunately, the hard way, is that as an entrepreneur business owner, you're someone who's typically a natural problem solver, typically uncomfortable with the unknown, typically self-motivated, all these things. And the typical employee is not that. So when you start to hire staff, you start to think, all right, I'm going to hire more people like me. And they're going to just extend my personal efforts. And then you kind of don't train them adequately, and they're only operating at 10-15% of their potential. So imagine that happens, locally. So imagine doing that with international workers who have no concept of the healthcare system in the United States. They're going to be operating at like 4%. So if you're going to work with an international workforce, I highly recommend that you come up with a clear training process for getting that person up to speed, even if it takes you 2 months to get them settled, 3 months, whatever it takes to really make sure that they understand. That's number one. One thing that we're doing with our services is that we're working with the international resources. We're developing training tools for them so that they already come to the market for our clients competent in some of the basics, so that training time is shortened and they already kind of are preconditioned to work in this space. So if you are in need of international workers, just reach out to us at passiveworkforce.com. You'll see our outsourced services, and then we could guide you along that path. Same way. Okay, it's me. What's the minimum to start an international visiting nurse agency? I have no idea what country you're in. What are the rates for nurses? Is it there? That's almost impossible for me to answer. So I don't know how much it's going to cost. Diana Washington. What's your email or website to purchase the package? Okay, so I'm going to key it in here. So the website is www.passiveworkforce.com. Okay. On that website, you'll find our online courses, which are self-directed, group mentoring. The group mentoring sessions are kind of like this, where it's Q&A between myself and our members. And it ranges from that all the way to full service setups. Now, the full service setups are more expensive and quoted based on where the company is physically, where they are in the formation process. And we don't really like disclosing our rates publicly. Just not something that we want to do or we have started to do yet. So it always starts with a conversation to understand where you're at, because in some states it's way more complex to get started and the prices are higher. If we start to say, oh, it costs X amount of thousands of dollars, and then you call us from one of those complex states and we quote you something differently, then it's going to be like, well, but you said. So everything, every quote is case by case. But all the self-directed courses and self-directed packages are online. The pricing is there. But if you go to passiveworkforce.com, you could go through our services and see exactly what fits you.
If you go to the full setup section, you can just click on get a quote, give us some information that we need, and we'll reach out to you with more details about that package and go over everything.
How much cha-ching for a 15-minute call? We don't do 15 minutes.
Now, the
Uh,
15-minute calls are to talk about our services. So if
yeah.
you're interested in purchasing something, you're just not sure what route to go, uh, that is going to be $0, but that is limited to 15 minutes to talk about that specific thing.
All right. I want one more question. All right, and then this is the last one because it's a good question. So, Mayor Brenner, do most hospitals offer stipend payments? Do they reimburse for accommodations, travel, and food? That is not how it works. So the travel stipends that are associated with the industry for food, accommodations, etc., are part of a total bundled price. It's up to the agency or to the employer to say, this is how we are paying it. So I'll give an example. They may be paying $150 an hour for an RN, right, through a set contract, 13-week term. It's going to be up to the agency or the facility directly if they're trying to attract travelers to make the offer on that budget of $150 an hour. This is how much we're going to set aside for housing. This is what the IRS allows for the per diem and contingent, like personal contingencies. This is how much we will pay to get you here physically. We'll cover your flight. We don't cover your flight. And this is what your weekly base salary is going to be, right? Or you could choose not to take the package, and this is what your total compensation will be per week because you don't need travel, you don't need the stipend, you don't need any. This is what we're going to pay. Which one is it? So it's not that the hospital is sitting there dictating, well, the stipend amount is this amount, except no, it's the agency looking at their master contract, looking at the total budget for that 13-week or 6-week cycle and saying, well, this is how we're going to carve out the budget. Okay. And we cover we cover these sort of details. Another says sometimes it's live sessions, sometimes it's on our channel, but we cover it in detail because to kind of go through how to design a travel package takes about half an hour to explain, I would say. So sometimes we'll do it in a webinar, sometimes we'll do it in a group chat, sometimes we'll do it directly on the channel. But to explain it here and now will be a little tough, but that's how it actually works. Well, that's our time. It's time to eat, have lunch, etc. So if you guys found this useful, please make your way on over to passiveworkforce.com. Leave us a Google review, right? That you participated in one of our live sessions, whatever you found it interesting. Those go a really long way. It helps us rank as far as the Google SEO algorithm works, right? The more reviews, the more credible, etc. So please and thank you for that. If you're not following us across social, this is more about the healthcare entrepreneurship, our healthcare consulting firm. We are Passive Workforce on YouTube, Passive Workforce on Instagram, same thing on Facebook. We have a Facebook group that is dedicated to healthcare entrepreneurship. It's a long name, and it is
I'll tell you the name.
Nursing Agency and Healthcare Staffing Entrepreneurs.
Mm-hmm.
We have right now, it's growing pretty quickly because we have about 1,200 active participants, all sharing ideas, all hopeful about starting a business in the healthcare space. And it's going to continue to grow because we share quite a bit of valuable knowledge there. So if you're not already a member of that group, definitely follow us there. We broadcast there as well. We repost all of our content there. So it's steady stream of information. Outside of that, if you're following me on ENTP Life, you know what I cover there. It's living globally, how to afford it. Well, this is one of the ways that I do it. If you are interested in the healthcare stuff, because I cover healthcare stuff on that channel, if you only want the healthcare stuff, Passive Workforce is the place to be. Continue to enjoy the rest of my content on ENTP Life, but everything that we do on Passive Workforce is about healthcare entrepreneurship, business tips, business development. That's where that content has been segregated to. The Facebook group name, Kareen, is Nursing Agency and Healthcare Staffing Entrepreneurs. Let me try to throw a link in here. That I think that would be a little more helpful. And also, as we update like the details of this live, we'll share links in the comment section, in the descriptions. Brenda will get all that information out and updated as the days go by, just so all that is cleaned up.
Yep.
But yeah, join that group. And did I miss anything?
I don't think so. Brenda just also added the name of the Facebook group on Instagram for everyone watching us on Instagram. It's also there. And yes, if you want to follow up on any of this information, talk about our services, talk about what you're doing, just go to passiveworkforce.com, review our services, and we'll stay in touch, I guess.
Take care.
Thank
And we're
you.
logging out.
Bye bye.
Thanks, Veronica. Bye.